Every year, millions of seniors go in for routine checkups, thinking they're doing the right thing. But what if I told you some of these very tests might actually raise your risk of stroke overnight? It sounds hard to believe, doesn't it? You trust your doctor. You follow every recommendation. But buried in the fine print of modern medicine are silent risks that no one warns you about. Not the news, not the brochures in your clinic, and sometimes not even your doctor. Imagine walking out of your annual checkup, thinking everything is fine, only to experience dizziness, blurred vision, or worse, just days later. And you're left wondering, what just happened? Here's the truth. Certain diagnostic tests, especially when done too often or under certain health conditions, may quietly trigger sudden spikes in blood pressure, disrupt blood flow, and even set off a chain reaction that can end in a stroke. But don't worry. This video isn't here to scare you. It's here to inform you, so you can ask better questions, so you can protect yourself and your loved ones. Because after the age of 60, it's not just about catching problems early, it's about avoiding the ones we might accidentally cause. In the next few minutes, we'll uncover the 5 most common medical tests that may carry hidden stroke risks, especially for seniors. And more importantly, you'll learn exactly how to protect yourself before your next appointment. If you're over 60, drop a 1 in the comments. If not, drop a 0. And make sure to subscribe to Health 365, where we uncover what others won't tell you. Now, let's talk about the first test you should think twice about. Now, if you've ever had a CT scan with contrast, you might remember that warm, flushed feeling spreading through your body. That's the contrast dye doing its job, helping your doctor see your blood vessels, organs, and tissues more clearly. Sounds helpful, right? But here's what many seniors are never told. That little injection can do much more than just enhance the images. It can quietly put stress on your cardiovascular system, especially if you're over 60 and already dealing with high blood pressure, heart problems, or kidney issues. For some people, the contrast dye triggers a vasovagal reaction, a sudden drop in both heart rate and blood pressure. This can lead to dizziness, nausea, fainting, or even brief unconsciousness. But in other cases, the opposite happens. Blood pressure spikes rapidly, and fragile blood vessels can tighten or go into spasm. When that happens, the risk of a stroke or cardiac event quietly creeps in. A study in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension, cardiovascular disease, or impaired kidney function. In short, the more vulnerable your system, the more dangerous that contrast dye could become. Let me share a real case. An 81-year-old man went in for a routine abdominal CT scan after having some minor digestive discomfort. The scan came back normal, and he was sent home feeling fine. But 2 days later, he suffered a minor stroke. The likely cause? The contrast injection may have temporarily spiked his blood pressure, causing a clot to form and block blood flow to part of his brain. This doesn't mean CT scans with contrast are bad. Far from it. They can detect cancers, blood clots, aneurysms, things that could save your life. But the key point is this. These scans should be used wisely, not just ordered as part of a routine checkup just in case. So what can you do to protect yourself? Before agreeing to a CT scan with contrast, ask your doctor, is this scan essential, or is there a safer option for someone my age and condition? Share your full history, especially if you have high blood pressure, kidney disease, heart conditions, previous reactions to contrast dye or medications, and always ask, can we do this without contrast? Sometimes a non-contrast CT or an ultrasound can provide enough detail without the added risk. Coming up next, a common screening many seniors get, even when they feel perfectly fine, that may not be as harmless as it seems. Now, let's talk about the stress test, also called the exercise stress test. On paper, it sounds like a smart move. Put on a heart monitor, walk on a treadmill, and see how your heart performs under pressure. But if you're over 60, especially with high blood pressure or heart conditions, this simple test could turn risky. Here's why. During the test, you're asked to walk or even jog on a treadmill while your heart is closely monitored. But as the speed increases, your heart rate shoots up, your blood pressure rises, and your cardiovascular system is suddenly under intense strain. For a healthy 30-year-old, this might not be a problem. But for seniors, especially those with pre-existing conditions, it can be like lighting a fire near dry brush, potentially triggering serious complications. Some of the risks: dangerous spikes in blood pressure, sudden arrhythmias, irregular heartbeats, and in rare but real cases, small tears in fragile blood vessels, especially in the brain. A 2020 study in the American Journal of Cardiology looked at over 1,300 patients above age 65 who underwent treadmill stress tests. The results? Nearly 7% experienced harmful events during the test, including blood pressure surges and abnormal heart rhythms. And the most affected group? Those who already had vascular issues. And this isn't just theory. It's real life. One of our subscribers, Margaret from Ohio, shared her story. She's 74 and has had high blood pressure for years. Her doctor recommended a stress test just to check in. Halfway through the treadmill portion, she began to feel dizzy and had tightness in her chest. They stopped the test immediately, but by the next day, she suffered a minor stroke. Doctors believe a sudden rise in her blood pressure during the test ruptured a tiny vessel in her brain. To be clear, the test didn't directly cause the stroke, but it introduced stress to an already vulnerable system, and that's what tipped the scale. So, what's the real takeaway? Talk to your doctor. Ask, is there a safer way to evaluate my heart? In many cases, a nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram may be safer options for seniors. And if you're not currently experiencing symptoms like chest pain, shortness of breath, or fatigue, ask whether the test is truly necessary right now, or if it can wait. Coming up next, we'll explore another routine test that seems harmless, but could come with hidden risks if you're not cautious. Let's now talk about something that's become incredibly routine, especially after 60. The endoscopy. Whether it's to check your esophagus, your stomach, or even your colon, doctors often recommend it just to be safe. And sometimes that makes sense. But here's what no one tells you. If you don't really need it, and especially if it involves sedation, it might do more harm than good. For starters, most people over 60 are on some kind of medication. Blood thinners like warfarin, aspirin, or Plavix are extremely common. And when you're sedated for an endoscopy, your blood pressure and circulation naturally change. Combine that with medications that affect your blood's ability to clot, and suddenly you're looking at a higher risk for internal bleeding, or worse, brain circulation problems that can trigger a silent stroke. In 2021, a large-scale review published in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent sedated endoscopy procedures, there was a significant increase in transient ischemic attacks, TIAs, also known as mini-strokes, within the following 72 hours. These weren't major strokes, but they were warning signs that something had gone wrong in the brain's blood flow. One case that stuck with me was from a 76-year-old woman who had a routine colonoscopy with sedation. She had no symptoms going in, but 2 days later, she started slurring her speech and lost coordination. The ER confirmed she had experienced a mild stroke. The doctors believed the drop in blood pressure during sedation, along with her daily aspirin use, may have created just the right conditions for a clot to travel. Even if the procedure itself is low risk, the combination of sedation, age, and medications can create a perfect storm. Now, this doesn't mean you should avoid all endoscopies, but it does mean don't agree to one unless your doctor can clearly explain why you need it right now. If you're just getting it because it's been a few years, ask if there's a safer way to monitor your condition, especially if you have no symptoms. Always remind your doctor about any medications you're on. Ask them, will I need to stop my blood thinner before this? What are the risks of sedation for someone like me? And if you're uncomfortable with sedation, ask if the procedure can be done without it, or with lighter options. Next, we're going to talk about another test that often flies under the radar, but it's one that involves something many of us never even think about: the kidneys. MRIs are powerful tools. They help doctors see deep into your body, spot early signs of trouble, and sometimes avoid unnecessary surgeries. But when a contrast dye is added, usually to get clearer images, that's when caution is needed, especially for older adults, and especially for those with even mild kidney problems. The contrast dye used in MRIs often contains gadolinium, a heavy metal. It doesn't stay in the body. It's meant to be flushed out by your kidneys. But here's the catch. After 60, kidney function naturally slows down. And if you already have chronic kidney disease or reduced function that hasn't been diagnosed yet, your body may not eliminate the gadolinium as effectively. Over time, small amounts can linger. That lingering can be dangerous. Gadolinium retention has been linked to a rare but serious condition called nephrogenic systemic fibrosis, NSF, which causes hardening and thickening of the skin and connective tissues. In the worst cases, it can limit movement, breathing, and even lead to organ complications. But here's the part most people don't hear about. Retained gadolinium has also been found in brain tissue, and some researchers believe it may cause subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people already at risk for circulatory issues. A study published in Radiology in 2019 tracked over 2,000 patients over 65 who received contrast-enhanced MRIs. Within a week of the procedure, about 5% reported stroke-like symptoms, headaches, blurred vision, balance problems. These weren't full-blown strokes, but they were red flags. Most of these patients also had underlying kidney issues, whether diagnosed or not. Harold, a 79-year-old veteran from Arizona, went in for an MRI after struggling with persistent back pain. His doctor ordered it with contrast, just to be thorough. Harold had no idea his kidneys were weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. It wasn't until his primary care doctor ran labs that they discovered he had stage 3 kidney disease. "No one warned me," he told us. "Had I known, I would have asked more questions." So here's what you can do. If your doctor recommends a contrast MRI, ask, "Can we do it without the contrast?" Often, the answer is yes. If contrast is truly necessary, request a kidney function test first. It's a simple blood test called a GFR, and it can give your doctor and you peace of mind. Also, let them know if you've ever had strange reactions to imaging tests in the past. Remember, the MRI itself isn't the problem. It's the extra chemical your body may not handle well. With the right precautions, you can still get the answers you need without putting your brain or kidneys at risk. Next, let's turn our attention to a test that seems harmless, even smart to do on a regular basis. But it may be steering older adults toward risky surgeries they never actually needed. The routine carotid artery ultrasound. It's non-invasive, takes just a few minutes, and doesn't involve any needles, dyes, or machines that make loud noises. Sounds like the perfect preventive test, right? But here's what most people over 60 don't know. If you don't have symptoms, and your doctor is just ordering this scan to check, this simple test might lead you down a path to surgery you never needed in the first place. The carotid arteries are the main blood vessels that deliver blood to your brain. Over time, like many vessels in the body, they can develop plaque, little buildups of cholesterol or calcium. That's normal, especially as we age. But not every bit of plaque needs to be removed. In fact, in many cases, it's safer to monitor it than to operate. Here's where things can go wrong. Let's say you get the test, and it shows some narrowing in the artery, maybe 50% or even 60%. That sounds scary, right? So your doctor refers you to a vascular surgeon, and suddenly you're being told you should consider a procedure, like a carotid endarterectomy or a stent. But if you had no symptoms, no dizziness, no vision changes, no weakness, these procedures might offer little benefit, and they carry real risks. In fact, a major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that in many cases, surgery did not reduce stroke risk significantly more than medication and lifestyle changes. And more troubling, a small percentage of patients who underwent surgery actually experienced strokes as a direct result of the procedure, either during surgery or in recovery. One story that really hits home comes from Helen, 82, from Pennsylvania. She went in for a checkup, felt perfectly fine, and had a carotid ultrasound because her doctor just wanted to be thorough. It showed 65% narrowing. She was sent for surgery within weeks. Sadly, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us, "I wish I'd known that doing nothing might have been safer." So, what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, "What are we looking for? And what happens if we find it?" Make sure you understand whether the scan is likely to change your treatment or simply cause worry. If you're already on blood pressure meds, cholesterol drugs, and living a healthy lifestyle, extra tests may not change much. And if you've already had a scan that showed some narrowing, don't panic. Ask about repeat scans instead of jumping to surgery. And always get a second opinion before undergoing any vascular procedure. Let's wrap this up with some warm advice and a gentle reminder that your health is in your hands. So here's the bottom line. Not every test is dangerous, but not every test is necessary either. Especially after 60, our bodies respond differently. What seems routine, like a contrast dye, sedative, or scan, can have ripple effects we don't always see coming. A simple injection might spike your blood pressure. A scan might trigger a reaction. Even a quick checkup can carry risks if your system is already vulnerable. That's why it's so important to pause, ask questions, and make sure every test fits your health needs, not just a checklist or protocol. You have every right to speak up. To ask, "Is this really essential?" To say, "Can we explore a safer alternative?" Because informed decisions lead to better outcomes and peace of mind. Your health story matters. Your voice matters. And here, we believe every choice should be guided by knowledge, not fear or habit. If you've ever felt strange after a scan or test, or watched a loved one go through something unexpected, drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. And if this video helped you feel a little more aware, more in control, or just more curious, subscribe to Health 365. We're here to uncover the truth, ask the hard questions, and always put your well-being first. Have you ever gone in for a routine test? Just a checkup? Nothing major. And then felt off? Dizzy, lightheaded, maybe even a little confused the next day. Most people brush it off. But as a brain doctor, I've seen too many cases where something seemingly harmless turned into a silent trigger for a stroke. Overnight. Let me be clear. It's not about doctors doing something wrong. It's about how certain procedures, which are considered standard practice, can affect an aging body differently. Especially after 60, when blood vessels become more fragile and your brain's tolerance for sudden shifts, like in blood pressure or hydration, starts to drop. And here's the scary part. Some of these tests are the exact ones your doctor might recommend to stay healthy. But what if the very thing meant to protect you could put you at risk? In this video, I'm going to walk you through 6 routine medical tests that might quietly increase your stroke risk, particularly in older adults. I'm not saying avoid them, but you do need to know what to watch for and what to ask your doctor before you agree to them. Before we dive in, just leave a quick 1 in the comments if you've ever felt weird after a medical test, or type 0 if everything's always been smooth. And don't forget to subscribe to Health 365 for more life-saving tips tailored for older adults. Let's start with something as common as an upper GI endoscopy. That upper GI endoscopy, specifically the kind where you're sedated. Sounds routine, right? You go in, take a nap, wake up, and it's over. But here's what most people don't realize. When you're sedated, your blood pressure often drops. For a healthy 30-year-old, that's usually not a big deal. But for someone over 60, especially if your blood vessels are already a bit stiff or narrowed, this drop can mean less blood reaching your brain, even for just a few minutes. Now imagine lying on your back for 30 to 45 minutes, under the influence of sedatives. Your heart has to work a little harder to circulate blood upward, and your brain might not get the oxygen it needs. For some, that results in temporary dizziness or a bit of confusion. But for others, especially those with a history of mini-strokes or blocked arteries, it can quietly trigger a transient ischemic attack, or even a small stroke. There's a 2019 study published in the Journal of Stroke and Cerebrovascular Diseases that tracked elderly patients who underwent sedated endoscopies. The researchers found that within 48 hours, a small percentage developed new neurological symptoms, mostly mild, but a few were more serious. The risk wasn't huge, but it was real, and it was often overlooked because no one thought to connect the dots back to the procedure. I once spoke with a patient named Helen, 72 years old, sharp as a tack. She had an endoscopy with light anesthesia. The next morning, she felt groggy, unsteady on her feet. Her family thought it was just the sedatives wearing off, but within a week, she was slurring words slightly. It turned out she'd had a small stroke, likely due to reduced cerebral blood flow during the procedure. So, what can you do? Talk to your doctor beforehand. Ask if the sedation is really necessary. In some cases, lighter options or even skipping sedation altogether might be possible. Make sure your blood pressure is well controlled before going in, and let your doctor know if you've had any episodes of dizziness, fainting, or prior strokes. One more thing. After the test, don't rush to get back to normal activities. Give yourself the rest of the day off. Stay hydrated. And if you feel dizzy, confused, or just not right, in the hours or days following, don't ignore it. Call your doctor, because even small changes in brain blood flow can leave a mark, especially as we age. All right. Let's move on to another test that might sound harmless, but can mess with your sleep and your brain. Holter monitoring, the kind where you wear a small ECG device for 24 to 72 hours, sometimes even longer. It's a great tool for spotting irregular heart rhythms, especially those that come and go. But here's the thing. This test isn't as harmless as it seems, especially for older adults. Imagine trying to get a good night's sleep with wires taped to your chest, a box strapped around your waist, and the anxiety of knowing every heartbeat is being recorded. Some people say it feels like being under surveillance. For many older folks, that leads to poor sleep. Or worse, no sleep at all. And we know what sleep deprivation does, don't we? When you don't sleep well, your body responds by ramping up stress hormones like cortisol. That can lead to nighttime spikes in blood pressure, something particularly dangerous if your arteries are already narrow or stiff. And it's not just the stress or poor sleep. Wearing that device reminds some people of past health scares, heart attacks, hospital visits. That emotional stress can be subtle but chronic over the few days of testing. Cortisol and adrenaline don't just mess with your heart, they affect the brain's delicate balance too. I had a patient, Tom, 66 years old, who wore a Holter monitor for 2 days. On the second night, he barely slept. He said he kept waking up, worried that he might roll over the device or pull a wire out. The day after he returned it, he felt lightheaded and mentally foggy. No major stroke, thankfully, but scans showed signs of reduced perfusion to parts of his brain. Not enough sleep, combined with elevated nighttime blood pressure, was likely the cause. So what should you do if your doctor recommends this test? First, ask if shorter monitoring might still give enough data. Some modern devices are less bulky. Ask if you can use those. And if you tend to have trouble sleeping with anything on your body, let your doctor know. Next, we'll explore a test that doesn't seem dangerous at all, until you look at what happens after it's done. Now, let's move on to something even more routine. A bone density scan, also known as a DXA scan. It's quick, painless, and doesn't involve any sedation. You lie on a table for a few minutes while a machine measures your bone strength. Sounds perfectly safe, right? And in most cases, it is. The scan itself doesn't pose much risk, but it's what often comes next that can quietly set off alarm bells. After a DXA scan, it's common for older adults to be told they have osteopenia or early-stage osteoporosis. And what's the first thing many are advised to do? Start taking calcium supplements, sometimes in very high doses, 1 to 200 times to 2,000 micrograms a day. Add in some vitamin D, maybe a bisphosphonate prescription, and you've got a full bone-strengthening routine. But here's the issue. When calcium builds up too quickly in your bloodstream, it can thicken your blood and increase your risk of forming tiny clots. This doesn't mean calcium is bad. Your bones do need it. But the timing, dosage, and your body's ability to absorb it all matter. For example, taking a large dose all at once, especially on an empty stomach, can cause blood calcium levels to spike. That spike can increase the risk of clot formation, particularly in people with a history of cardiovascular issues. I once met Linda, 70, who was told her DXA results showed bone thinning. She started a high-calcium regimen right away, 2 pills every morning before breakfast. Within a month, she felt tightness in her chest and numbness in her hand. A CT scan later revealed a small stroke. Her calcium levels were well above normal, and her doctors traced it back to the supplements. So here's what you can do. Don't start any supplements without checking your blood calcium levels first. Ask your doctor whether dietary calcium from food might be a better option than pills, and be sure to stay hydrated. Thicker blood means higher stroke risk. If you've ever had heart or brain vessel problems, mention that before starting any new bone treatments. All right, let's take a look at another common procedure. One that involves sedation, just like our first example, but with an even bigger risk for some people. Colonoscopy. Another test that often involves sedation, and it's one nearly every older adult is encouraged to get. Screening for colon cancer is important, no doubt. But here's something most people don't consider. The sedatives used in a colonoscopy can have a surprisingly strong effect on your blood vessels, especially if they're already fragile. You see, sedatives like propofol or midazolam don't just relax your body, they also relax your blood vessels. That leads to a sudden drop in blood pressure. Now, if your brain is used to functioning at a certain pressure level, this sudden dip can reduce the flow of oxygen and nutrients to your brain cells, just for a moment. But sometimes that's enough to cause problems, especially if you already have narrowing in the arteries that feed your brain. A 2021 review in the Journal of Geriatric Medicine found that older adults who received moderate sedation during procedures like colonoscopies had an increased risk of post-procedure dizziness and brief neurological symptoms. In a few rare cases, patients had full-on strokes within 24 to 72 hours. The culprit? Often a sharp, short-term drop in blood flow during sedation. I remember a man named George. He was 74, active, and pretty healthy overall. He had a routine colonoscopy with sedation. Everything seemed fine at first, but the next morning he had trouble speaking clearly. His wife thought maybe he was just tired. A few hours later, he collapsed. Doctors found he'd had a small stroke, likely triggered by reduced cerebral blood flow during the procedure. So what can you do to protect yourself? First, talk with your doctor about your stroke risk before scheduling the colonoscopy. Let them know if you've had any episodes of TIA, or mini strokes, or if you've felt unusually lightheaded during past procedures. Ask if lighter sedation or an alternate screening method might be appropriate for you. And after the procedure, take it slow. Rest. Drink plenty of water. Have someone with you for at least 24 hours. If you notice any speech slurring, vision changes, or confusion, even if it seems minor, don't wait. Call your doctor immediately. Coming up next, we'll look at something almost no one questions: stopping your meds before a small surgery. But the timing of that decision, it can make all the difference. Now here's something most people never think twice about: stopping your blood thinners before a dental procedure or minor surgery. It sounds routine. Your dentist or surgeon says, "Let's pause your aspirin or warfarin for a few days so you don't bleed too much." And you nod along, thinking it's just temporary. But here's the dangerous part. When you stop a blood thinner, your body doesn't just return to normal, it often rebounds. That means your blood can actually become more prone to clotting for a few days. A 2017 study in the journal Stroke followed older patients who temporarily stopped anticoagulants before procedures. It found a noticeable uptick in ischemic strokes, most occurring within 7 days of stopping the medication. Even more alarming, the study showed that the highest risk was not in people who stayed off the meds for too long, but in those who didn't restart them soon enough. I remember a patient named Margaret. She was 68, on low-dose aspirin for years after a mild heart attack. Her dentist asked her to stop the aspirin before a tooth extraction. No big deal, right? She skipped it for 3 days before and 3 days after, but that pause was enough. On day 5, she developed a headache and numbness on her left side. A CT scan showed a small stroke. If she had restarted her aspirin 24 hours after the procedure, as guidelines often suggest, she might have avoided it entirely. The key takeaway? If your doctor tells you to stop a blood thinner before a minor procedure, ask 2 crucial questions. How long exactly should I stop it? And when should I restart? Timing matters. It's not just about bleeding. It's about avoiding a dangerous rebound in clotting risk. Also, always let both your primary care doctor and the specialist know you're pausing the medication. Too often, no one coordinates, and patients fall through the cracks. Keep a written plan. Mark the restart date on your calendar. And if anything feels off, dizziness, trouble speaking, or weakness, don't wait. Next, we'll look at the last test on our list: It sounds so simple. Just a fasting blood test. But skipping meals for too long can quietly put your brain at risk. You're told to skip breakfast, maybe even skip drinking water, then head in for labs first thing in the morning. Seems harmless, right? But for older adults, going without food or fluids for 10 to 14 hours can quietly push the body into a state that's far more dangerous than most realize. As we age, our bodies aren't as good at regulating blood sugar and hydration. A long fast can lead to low blood sugar, what doctors call hypoglycemia, and even mild dehydration. Now combine those two things, and what do you get? Thicker, stickier blood. And that raises the chance of forming tiny clots that can travel to the brain. A 2018 study published in the Journal of Clinical Endocrinology and Metabolism looked at older adults undergoing fasting labs. It found that individuals over 65 who fasted more than 12 hours without proper hydration had a significantly increased risk of post-test dizziness, fatigue, and, in a small number, mini-strokes. The common thread? Mild dehydration, low blood sugar, and pre-existing vascular issues. I had a patient named Samuel, 73, who went for his yearly labs. He skipped breakfast, didn't drink water in the morning, and had his blood drawn around 10 a.m. While driving home, he started to feel woozy, then completely blacked out at a stoplight. Fortunately, no accident happened, but scans later revealed a transient ischemic attack, a warning sign that a major stroke could be next. So, what should you do? First, ask your doctor if fasting is really necessary. Many modern labs can now get accurate results even without a full fast, especially for cholesterol and glucose testing. If you do have to fast, drink water, lots of it. Staying hydrated keeps your blood thinner and reduces clot risk. And schedule your test as early in the morning as possible so you're not running on empty too long. After your test, don't jump straight into errands or appointments. Bring a snack with you, something with protein and a little sugar, and eat right after the blood draw. Sit down for a few minutes, drink more water, and give your body a chance to stabilize. Even the smallest actions, like sipping water or eating a banana, can make a big difference when it comes to protecting your brain. Because after 60, your body isn't just reacting to the test, it's reacting to everything that leads up to it. Now that we've gone through these 6 silent risks, let's take a moment to wrap things up and talk about how you can stay safer, stronger, and more aware moving forward. Just because a test is routine doesn't mean it's risk-free, especially as we get older. Your body isn't the same at 65 as it was at 35, and even small changes, like a skipped meal, a sedative, or a paused medication, can have ripple effects on your brain and heart. But here's the good news. When you're aware of the risks, you can take steps to protect yourself. You can ask better questions, plan better recoveries, and make sure you're not just following orders, but making informed choices. That's not fear, it's wisdom. If you've ever felt off after a test, don't brush it aside. Speak up. And if you learned something today, share this video with a friend or loved one. It could help them too. Drop a 1 in the comments if this opened your eyes, or a 0 if you already knew these risks. And be sure to subscribe to Health 365 so we can keep bringing you clear, honest, life-saving advice every week. You've made it this far. Thank you for caring about your health. Keep asking, keep learning, and take good care. Did you skip your morning coffee today? Just because of a blood test? Or maybe you skipped water altogether, thinking you were doing the right thing. Well, as a brain doctor, let me tell you something shocking. 1 or 2 small mistakes before a blood test, especially after the age of 60, can quietly raise your blood pressure, thicken your blood, and in worst cases, trigger a stroke. Yes, I know. Blood tests are supposed to be safe, Routine? No big deal, right? But here's the truth. Most doctors don't say out loud. For older adults, especially those with delicate blood vessels and a nervous system that's a bit less responsive, getting it wrong before a blood draw isn't just uncomfortable. It can be dangerous. And you know what's even more worrying? Most people over 60 unknowingly make at least 3 of the 10 critical mistakes I'm about to share. Not just once, but every single time they go for a blood test. That's why you need to watch this entire video. Because the risks aren't in the needle. They're in what you do before the nurse even walks in the room. Stick with me, and I'll show you how to protect your brain, your heart, and maybe even your life, starting from your next blood test. If you've ever felt dizzy, tired, or a little off after getting your blood drawn, drop a 1 in the comments. If not, hit 0. And don't forget to subscribe to Health 365 for more life-saving tips. Now let's talk about what skipping a simple glass of water could be doing to your brain. Let's start with the one mistake that sounds harmless, but can quietly lead to trouble: not drinking any water before your blood test. You see, many people think fasting means don't eat or drink anything, so they skip not just breakfast, but water too. That's a big problem, especially for anyone over 60. When you're even slightly dehydrated, your blood becomes thicker. It flows more slowly, and your heart has to work harder to push it through. That alone can make your blood pressure spike right before the test. But what's even more dangerous? Thickened blood has a harder time reaching your brain. That's when people start feeling lightheaded, dizzy, or worse, experience a mini-stroke called a TIA, transient ischemic attack. It can happen without warning, especially when your vessels are already sensitive due to age. A 2022 study from the Journal of Vascular Health showed that seniors who fasted without proper hydration were nearly twice as likely to experience abnormal blood pressure swings during routine morning exams. And you know those fainting episodes some folks have after a blood draw? Often, it's not the needle, it's the dehydration. So here's a simple habit to keep you safer. About 1 to 2 hours before your blood test, drink an 8-ounce glass of water. Not too much, not too little. Just enough to help your blood flow easily, protect your brain, and keep your numbers accurate. And speaking of what you put into your body before a test, let's talk about something salty you might have eaten last night without realizing the risk. Now, let's talk about what you had for dinner last night. Specifically, how much salt was on your plate. Maybe it was a warm bowl of canned soup, or a quick bite of instant noodles. You thought, it's just one meal. The test is tomorrow morning. No big deal. But here's what actually happens. High-sodium meals, especially late in the evening, can push your blood pressure up while you sleep. And since blood pressure naturally rises in the early morning hours, that salty dinner acts like a double whammy. It sends your pressure soaring just when you're headed to the clinic. Now think about this. Your arteries aren't what they used to be. As we age, they stiffen. They don't expand and contract like they did in our 30s. So when the pressure spikes, there's nowhere for it to go. That puts direct strain on your brain, especially those tiny blood vessels deep inside. The American Journal of Hypertension published a study showing that in older adults, late-night salty meals increase the risk of early morning strokes by nearly 35%. And that's before the needle even touches your skin. Plus, if you're dehydrated from fasting, salt pulls even more water out of your cells, thickening your blood further and throwing off your electrolyte balance. So, what can you do? The night before your test, go light on the salt. Avoid packaged or processed foods. No salty chips, no soy sauce dips, no deli meats. Stick to home-cooked meals with minimal seasoning. Your brain and your heart will thank you. Now, while we're talking about test prep, there's another mistake that's just as risky, especially if you're taking medications for your heart. Let's look at that next. Let's say you've got a blood test coming up and you're wondering, should I take my morning meds? So, you skip your blood pressure pill, or that little tablet that thins your blood. Stop right there. Unless your doctor specifically told you to skip a dose, never assume it's okay to stop your medication before a test, especially heart or blood pressure meds. Missing even one dose can cause a rebound effect. Your blood pressure might shoot up unpredictably, or your blood could suddenly become more prone to clotting. And for older adults, that's no small thing. Take, for example, a 2021 study from the Cleveland Clinic. They found that patients over 60 who paused their antihypertensive medications without medical advice had a 42% higher chance of experiencing abnormal spikes in systolic blood pressure during routine tests. And in some cases, it triggered emergency care within hours. The same goes for blood thinners. Skipping them could increase the risk of a stroke from sudden clot formation, especially during stress, dehydration, or fasting. Now I get it. Sometimes we worry that meds might interfere with blood test results. But here's the truth. If a medication could affect your lab values, your doctor will tell you exactly how to manage it ahead of time. Guesswork is dangerous. So before your next test, check with your physician. Ask clearly, should I take my morning pills before the blood draw? It's a 5-minute conversation that could save your life. Next up, let's talk about something a lot of people think they're doing right, but it actually puts your brain at risk. Fasting longer than you need to. Many folks think, if 8 hours is good, then 14 must be better. So they stop eating after lunch the day before, skip dinner, skip breakfast, and show up to the lab running on fumes. The problem? When you fast longer than 12 hours, especially without proper hydration, your blood sugar drops too low. And that's not just about feeling weak or hungry. Low blood sugar can affect your brain, your balance, and your blood pressure. It can make you faint before you even sit down for the test. Older adults are especially sensitive to this. A study from Johns Hopkins in 2020 followed patients over 65 who fasted more than 13 hours before blood tests. Nearly 1 in 5 experienced symptoms like dizziness, blurry vision, and in some cases, brief loss of consciousness, before or right after their blood draw. And these weren't folks with major health problems. These were everyday seniors trying to do it right. So here's the smarter approach. Unless your doctor says otherwise, stick to a 10 to 12 hour fast. No longer. If your test is at 8 a.m., have a light dinner around 7 or 8 p.m. the night before. That's enough time for accurate results without pushing your body into a danger zone. Oh, and don't forget to drink that glass of water. Coming up next, let's talk about a morning habit that feels harmless but could be sending your heart into overdrive before your blood test even begins. For decades, it's been part of our routine, especially before heading out for something like a blood test. It wakes us up, gives us focus, and frankly, it feels like a hug in a cup. But here's the catch. Caffeine isn't just waking up your brain. It's also waking up your heart. And sometimes pushing it too far. When you drink coffee right before a blood draw, caffeine can cause your heart rate to increase and your blood pressure to spike, especially in people over 60. That can create false readings in your test, or worse, put stress on blood vessels already vulnerable with age. A clinical review in Hypertension Research in 2021 found that seniors who consumed coffee within 2 hours of testing had, on average, a 12-point higher systolic reading. That's enough to mislead your doctor or mask an actual blood pressure problem. But it's not just about numbers. That rush of caffeine can make you feel jittery, lightheaded, or even anxious right before your blood is drawn. And if you've been fasting too, that coffee hits harder. On an empty stomach, it can trigger a blood sugar crash or rapid heartbeat. Now, what about exercise? You might be surprised at what a morning workout can do before a blood test. So, you're trying to stay healthy, and maybe you like to start your day with a bit of movement. That's great. But if you're heading to a blood test, your morning workout might be doing more harm than good. You see, exercise, especially anything intense like brisk walking, resistance bands, or even heavy gardening, raises your heart rate and blood pressure temporarily. That's normal. But when you're over 60 and your cardiovascular system is already working a little harder to maintain balance, this temporary spike can cause misleading lab results or even push your heart too far, too fast. A 2020 study from the American Geriatric Society followed older adults who exercised within 2 hours before routine blood tests. Results showed significant fluctuations in blood pressure readings, heart rate, and stress hormone levels, enough to distort the interpretation of key biomarkers. Even more concerning, a few participants reported dizziness and chest discomfort during their tests, not because of the needle, but because their body hadn't fully recovered from the workout. If your blood vessels are already a bit stiff and your hydration's off from fasting, exercise can temporarily reduce blood flow to the brain. That's a recipe for lightheadedness, or worse, a TIA. So what should you do? Keep it gentle. Skip the treadmill, the weights, or even that power walk. Instead, stick to light stretching or deep breathing. Save your full workout for after your blood draw. And speaking of circulation, let's talk about something most people never think twice about: what you're wearing. Clothing. Yes, what you wear to your blood test matters more than you think. It's a common habit: pulling on tight sleeves, snug compression gear, or even a belt that fits a little too well. We want to look neat, especially for a doctor's visit. But tight clothing, especially around the arms or waist, can quietly interfere with your circulation. And for someone over 60, that can cause real problems. When blood flow is restricted, even slightly, your veins don't respond well. It can make it harder for the nurse to find a good vein, which means longer needle time, more pokes, and more discomfort. But even after the blood is drawn, that restricted circulation can lead to unexpected dizziness, numbness, or even fainting. A study in clinical nursing research showed that older adults wearing tight sleeves or waistbands during lab visits were more likely to experience delayed onset dizziness after the draw, especially when combined with fasting or mild dehydration. So, here's your move. Wear something loose and comfortable. Choose a short-sleeve shirt or something with sleeves that roll up easily. Keep belts and waistbands relaxed. You'll feel better, recover faster, and reduce the chance of complications. Next, let's take a look at something you might not even notice. But it has a big impact on your brain and heart: how well you slept the night before. Sleep. It seems simple, but missing even a few hours the night before your blood test can quietly increase your stroke risk. When you don't sleep well, whether from stress, discomfort, or just tossing and turning, your body pays the price the next morning. And for older adults, the effects hit even harder. Poor sleep doesn't just leave you tired, it disrupts the systems that keep your heart and blood vessels in check. Studies show that a lack of sleep causes your sympathetic nervous system, the part responsible for fight or flight, to kick in early. That raises your blood pressure, narrows your blood vessels, and increases heart rate. A study from the Journal of Sleep Research in 2021 found that adults over 60 who slept less than 5 hours before a medical test had significantly higher chances of experiencing vascular spasms during and after blood draws. Even if you don't feel tired, your body is already stressed before you walk into the clinic. And when you pair that with fasting, anxiety, or mild dehydration, your risk of lightheadedness, irregular heartbeat, or TIA rises sharply. So what should you do? The night before your test, wind down early. Turn off screens an hour before bed. Keep the room cool, quiet, and dark. Aim for 7 to 8 hours of rest. Your brain, your heart, and your blood vessels need it. And when the test is done, don't rush off just yet, especially not behind the wheel. Let's talk about why. You've finished your blood test, rolled down your sleeve, and you're ready to head home. But if you haven't eaten yet, and you're planning to drive, hold on just a minute. Driving yourself right after a fasting blood draw might seem harmless, but it's actually one of the riskiest things you can do, especially if you're over 60. Here's why. When you've gone 10 to 12 hours without food, your blood sugar is already low. Add the stress of the blood draw, possible dehydration, and maybe even a poor night's sleep, and your body is in a fragile state. Now imagine you're behind the wheel. A sudden drop in blood sugar can lead to dizziness, blurred vision, delayed reaction times, or even fainting. That's not just dangerous for you, but for everyone on the road. A case study published by the American Journal of Emergency Medicine documented several instances of older adults experiencing fainting spells or confusion within 30 minutes of leaving a clinic, most while driving alone. The common factor? Fasting and skipping post-test recovery. So, what's the safer plan? Bring a small snack, something with protein and a bit of healthy carbs, and eat it right after your test. Rest for 10-15 minutes at the clinic if you feel even slightly off. And if possible, ask a friend or family member to drive you home. One more thing. If you feel unwell even hours after the test, don't ignore it. Let's talk about that next. So you've made it through the test, had your snack, and you're back home. But suddenly, you feel a little dizzy, maybe a bit nauseous, or just off. You think, it's probably nothing. I'll just rest. But here's the thing. Those small symptoms could be your body's way of waving a red flag, especially if they happen within hours after a blood draw. For adults over 60, even mild dehydration or a sharp drop in blood sugar can cause a chain reaction in the nervous system. And sometimes that leads to a mini stroke, what doctors call a transient ischemic attack, or TIA. It's a short-lived disruption of blood flow to the brain that may last just minutes, but ignoring it can be a serious mistake. In fact, a 2022 study published in Stroke Journal found that nearly 15% of older adults who reported dizziness or nausea after fasting blood tests were later diagnosed with signs of minor brain ischemia, tiny strokes that often go unnoticed. These symptoms don't always come with pain. No slurred speech, no facial drooping, just a vague discomfort or unsteadiness. That's why they're easy to brush off and easy to miss. So here's the rule. If you feel dizzy, lightheaded, nauseous, or unusually weak after a test, don't just wait it out. Sit down, hydrate, and let someone know. If it doesn't pass quickly, or if it feels worse, call your doctor. Now, let's wrap this up with a few things to keep in mind before your next visit. A blood test might seem like a small thing, but after 60, even simple routines can affect your heart, your brain, and your safety more than you realize. The good news? You have control. Drink just enough water. Don't skip your meds without asking. Sleep well. Eat light the night before. And most of all, listen to your body. These aren't big changes, but they protect you in big ways. If this video gave you even one helpful tip, drop a 1 in the comments. And don't forget to subscribe to Health 365, because every small step you take brings you closer to stronger days ahead. If a sudden rush of dizziness hit you, your arm went numb, and you knew something was terribly wrong, what would you do if you were all alone? Most people freeze, thinking they'll wait it out. But in a stroke, Every second is a battlefield in your brain. Those first 10 seconds could decide whether you walk out of the hospital or never walk again. The truth is, strokes don't give warnings you can ignore for later. Brain cells start dying within minutes, and the clock doesn't stop just because you're scared or unsure. In those moments, hesitation is the most dangerous choice you can make. That's why today, we're diving into a life-saving plan you can actually remember. A plan you can put into action even when fear wants to take over. It's not about fancy medical terms or complicated steps. It's about simple, fast actions that give your brain a fighting chance when you don't have anyone there to help you. Think of it as your personal emergency script. The exact moves you'll make when every heartbeat counts. Because the more prepared you are now, the less you'll have to think when it really matters. Before we begin, tell me this. Type the number 1 in the comments if you'd like to know these steps by heart, and type 0 if you think you could handle it on your own right now. And while you're there, go ahead and subscribe to Health 365 so you never miss a tip that could one day save your life. Let's step right into that crucial first action, the one that can set everything else in motion before it's too late. The very first move, and the one that matters most, is to get professional help on the way immediately. The second you feel that wave of dizziness, that numbness in your arm, or that strange weakness in your face, grab your phone and dial 911 without hesitation. Don't stop to second-guess yourself or wonder if it's really a stroke. In stroke care, speed is everything. And the worst mistake you can make is waiting to see if it passes. When you call, you don't have to explain every detail perfectly. Just say the word stroke, give your address as clearly as you can, and put your phone on speaker so you can keep moving while help is on its way. The emergency dispatcher is trained to get critical information in seconds and alert paramedics instantly. Those precious minutes you save now can be the difference between a full recovery and permanent damage. If your speech is already slurred, or your mouth won't form the words, don't hang up in frustration. Stay on the line. Even your breathing patterns, background sounds, and occasional noises can help them locate you. If you can, repeat, help, stroke, slowly. That alone can trigger an urgent response. And if your phone isn't within reach, or you've dropped it, use your voice or any noise you can make. Yell, bang on a wall or floor, knock over something heavy. Anything that could alert a neighbor or passerby. The goal is simple. Get help moving toward you while you still have the strength to take the next step in your survival plan. Once you've made sure help is on the way, your next mission is to protect yourself from injury while you wait. A stroke can cause sudden weakness, dizziness, or even blackout without warning. If you stay standing, you risk collapsing, hitting your head, or breaking a bone, all of which can make an already dangerous situation much worse. Your safest move is to get low before your legs betray you. If you can, slowly lower yourself onto the floor, a bed, or a couch. Avoid sudden movements. Take your time, even if you feel panicked. Once down, lie on your side with your stronger side underneath you. This position keeps you more stable and helps prevent you from rolling onto your stomach or back if you lose consciousness. Tilt your head slightly back to keep your airway open, and use a pillow, folded blanket, or even a jacket to gently raise your head and shoulders. This small elevation may help reduce pressure inside your skull and keep blood flowing more evenly. Don't raise your head too high, just enough to be comfortable and safe. If you're close to a door, think ahead. Unlock it now or wedge it open so emergency responders can reach you without breaking it down. If you can't reach the door, position yourself where you can be seen easily, such as near a hallway or in front of a window. Finally, focus on stillness. Any unnecessary movement drains precious energy your body needs to survive. Keep your breathing steady, your mind focused, and your body ready for the next step in your survival plan. Once you're in a safe position, your next priority is making sure emergency responders can reach you without delay. Every second they spend breaking down a door or figuring out how to get inside is time your brain can't afford to lose. If you still have the strength, carefully move to your front door and unlock it. Disengage any chain locks, bolts, or security latches. If you can, open the door a few inches so paramedics can enter immediately. For those in apartments or gated communities, keep your phone within reach. The dispatcher may call back to confirm an entry code, gate access, or to buzz them in. If the door is too far or you feel unstable, don't risk falling. Instead, focus on making your location obvious. Call out for help in a loud, clear voice every few seconds. Help, stroke. This repetition ensures that if rescuers are nearby, they'll hear you even over other noises. If you're close to a window, knock on it firmly or use an object to tap loudly against the glass. Look for ways to make yourself visible. Turn on as many lights as possible, even during the day, to create a bright beacon. If you can reach a hallway, place an object like a brightly colored blanket or pillow in the doorway where it can be seen from outside or down the hall. This step is all about clearing barriers between you and the people racing to save your life. The faster they reach you, the sooner they can begin life-saving treatment. And in a stroke, those saved seconds could be the difference between walking again or living with permanent disability. With help on the way and your space prepared for quick access, your focus now shifts to two things: making yourself findable and protecting your remaining strength. During a stroke, your body is already under extreme stress. Every unnecessary movement, every burst of panic, drains energy your brain needs to survive the attack. If you still have the ability to make noise, use it strategically. Every 15-30 seconds, call out, "Help," or "In here," so rescuers can pinpoint your location the moment they arrive. If you're near an object that can create sound, like a pot, pan, or hard surface, tap it rhythmically. This is especially useful if your voice weakens or fades. At the same time, keep your body as still and supported as possible. Resist the urge to get up, walk, or test your strength. Sudden weakness or loss of balance could cause a dangerous fall. Breathe slowly and deeply, in through your nose and out through your mouth, to help maintain oxygen flow and calm your nervous system. If you have a medical alert device, now is the time to press it. If you don't, but you can reach your phone, keep the line to the dispatcher open. Even if you can't speak clearly, they can listen for clues and guide rescuers in real time. Think of this step as your holding pattern. You're not just waiting. You're actively helping your rescuers find you faster and keeping your body stable until they arrive. These small, deliberate actions can buy your brain precious minutes and greatly improve your odds of recovery. While you wait for help, one of your most important jobs is protecting your airway. A stroke can weaken the muscles in your face, tongue, and throat, making it harder to swallow or control saliva. If you're lying flat on your back, this weakness can cause fluids, saliva, mucus, or vomit to pool in your throat, putting you at risk of choking or blocking your own airway without even realizing it. The safest position remains on your side, with your stronger side down and your head slightly tilted forward. This uses gravity to keep your airway open and allows any fluids to drain away from your mouth and throat. If you start to feel nauseous, resist the urge to sit up quickly. Instead, let your head and shoulders roll forward so fluid can exit naturally. Stay mindful of your breathing rhythm. Aim for slow, controlled breaths. Inhale through your nose. Exhale through your mouth. Avoid panicked, shallow breathing, which wastes energy and can make you feel more dizzy. If your throat feels tight, consciously relax your jaw and let your tongue rest loosely to open the passage for airflow. If you have dentures or any removable dental device and can safely remove them, do it now. This lowers the risk of them becoming a choking hazard. Also, loosen any tight clothing around your neck or chest, like scarves, ties, or snug collars, so nothing restricts your breathing. Oxygen is the fuel your brain cells are fighting for right now. By keeping your airway clear and your breathing steady, you're buying those cells precious time. Time that could mean the difference between recovery and permanent damage when help arrives. One of the most dangerous things you can do during a stroke is drift off to sleep or lose alertness before help arrives. As blood flow to parts of your brain is reduced or blocked, your body may try to shut down, but you must fight to stay awake and aware. The longer you stay conscious, the more you can respond to changes, give rescuers important information, and protect yourself from secondary dangers like choking. If you feel yourself fading, focus on keeping your eyes open and your mind engaged. Talk out loud, even if no one is there. Repeat your name, the time, your location, and the word stroke over and over. This isn't just to keep your brain active. It also means that if you do lose consciousness, the last thing a responder hears from you is exactly what they need to know. If your phone is still within reach, keep the line to the dispatcher open. Even if you can't form full sentences, let them hear you breathing, groaning, or making any sound. This reassures them you're still alive and gives them cues if your condition worsens. Light physical stimulation can help you stay alert. Gently tap your thigh or pinch your fingertips on your stronger side to keep some sensory input flowing to your brain. Just avoid moving so much that you risk falling or shifting into an unsafe position. Your goal here isn't to power through the stroke. It's to hold on long enough for help to take over. Every extra moment of awareness increases the chance that your first treatment begins with your brain still fighting, not already fading. Even after you've called for help, positioned yourself safely, and worked to stay alert, a stroke can still evolve rapidly. New symptoms can appear within minutes, and recognizing them could help you relay vital information to rescuers when they arrive. Pay close attention to changes in your body. If weakness spreads from one limb to another, note which side is affected. If your speech suddenly worsens, your vision blurs, or you develop a pounding headache, try to say it out loud or repeat it into the phone for the dispatcher. These updates help paramedics assess the severity and type of stroke faster, which can speed up treatment once you reach the hospital. Be aware of sudden changes in breathing or heartbeat. If you feel your chest tightening, your pulse racing, or your breathing becoming shallow, focus on slow, deep breaths to maintain oxygen flow. Mention these changes to the dispatcher, as they can signal complications that need immediate attention. If you lose feeling in part of your body, check periodically with your stronger hand or foot to see if it's spreading. Even small details, like when you first notice the change, can be important to doctors later. Most importantly, avoid panicking when new symptoms arise. Panic raises blood pressure and puts more stress on your brain. Instead, focus on reporting and managing what you can, keeping yourself as stable as possible until trained hands take over. The calmer and more informed you remain, the better your odds when every second matters. While you wait for help, there are small, careful actions you can take to support circulation to your brain without overexerting yourself. The goal here is gentle assistance. Nothing that could dangerously raise your blood pressure or worsen bleeding in the case of a hemorrhagic stroke. If you're already lying on your side, keep your head slightly elevated with a pillow, folded blanket, or even your arm. Make sure your neck stays straight, not twisted or bent sharply, to avoid compressing arteries that feed your brain. This position also helps oxygen-rich blood flow more easily upward. Light movement can help prevent blood from pooling in your lower body. On your stronger side, flex and point your ankle slowly every 10-15 seconds, or gently wiggle your toes. These small actions activate your calf muscles, which work like pumps to keep blood moving back toward your heart and brain. Avoid crossing your legs tightly or curling into a ball, as this can restrict circulation. Keep your posture open, with your chest and abdomen uncompressed, so your breathing remains deep and steady. Temperature matters too. If you're cold, your blood vessels constrict, limiting flow. So pull a blanket or coat loosely over yourself, but don't wrap too tightly. Finally, pair your position with controlled breathing. Inhale slowly through your nose, then exhale through your mouth, imagining each breath as fuel feeding your brain cells. These small, deliberate measures aren't a cure, but they can help keep your system stable until trained hands take over, buying you those precious extra minutes that can make all the difference. In the final stretch before help arrives, your mind becomes just as important as your body. Fear and panic can make your heart race and your blood pressure spike, putting even more strain on a brain already under attack. But if you can shift into calm, focused thinking, you can steady your breathing, keep oxygen flowing, and buy yourself precious time. Start with short, simple commands. I am safe. Help is coming. I will hold on. Say them out loud if possible. The sound of your own voice can help keep you alert. If speaking is too hard, think the words in a slow, steady rhythm, matching them to your breathing. This mental anchor keeps your thoughts from spiraling and helps you stay conscious. Remind yourself of the victories you've already achieved. You called for help. You positioned yourself safely. You've made it easier for rescuers to find you. These steps mean you're not powerless. You've taken control of what you can, and that control matters. If you feel yourself slipping toward unconsciousness, fix your attention on one detail in your surroundings: the ticking of a clock, the hum of a refrigerator, the pattern of light filtering through a curtain. Let it be your lifeline, pulling you back from the edge. Picture help arriving, the wail of sirens growing louder, hurried footsteps approaching, the sight of a paramedic's reassuring face. Hold on to that image. It keeps your brain engaged, your willpower strong, and your focus locked on survival. A stroke is a fight for every second your brain can keep working. By controlling your mental state and refusing to let panic take over, you give yourself the best possible chance to stay alive until help walks through your door. So, if there's one thing I hope you carry with you after watching this, it's that a stroke doesn't have to win just because it strikes when you're alone. Those 10 seconds we talked about aren't just numbers. They're a window, a lifeline, a chance to protect the person you've spent your whole life being. Every breath you take, every clear thought you can hold on to, matters. You might never need these steps, and I truly hope you don't. But if that moment comes, you won't be standing in fear. Frozen? You'll know exactly what to do. And that confidence could be the reason you walk, talk, and smile again. Remember, your brain is the command center of everything you love to do. From holding your grandchild's hand to telling your favorite story at the dinner table. Protect it like you'd protect your family. If this video gave you even one tool that could make a difference, share it with someone you care about. You might save their life before they even know it's in danger. And don't forget to subscribe to Health 365. Because the more you know, the more power you have over your own health. Stay safe, stay prepared, and keep living fully. Your future self will thank you. Can you imagine lying in bed at night, thinking you've just enjoyed a light, healthy snack, only to be unknowingly setting your body up for the perfect storm? Every year, Thousands of Americans over 60 suffer strokes in their sleep. And for many, the trigger starts in the kitchen just a couple of hours before bedtime. The part that shocks me most is that these snacks often wear a shiny, healthy label, making us feel safe while quietly straining our blood vessels. You might recognize some of them from your own pantry. Tonight, we're going to peel back that label and uncover which so-called healthy treats could be pushing your blood pressure higher, thickening your blood, or speeding up your heartbeat when your body should be resting. I'm not here to scare you, but to help you stay one step ahead so you can enjoy your evenings without giving your heart and brain extra stress. If you've ever reached for a snack before bed thinking, "It's fine, it's healthy," I want you to watch this until the very last second, because by the end, you'll know exactly which choices could be quietly working against you. And hey, if you're curious already, drop me a simple 1 in the comments if you usually snack before bed, or a 0 if you don't. And make sure you're subscribed to Health 365 so we can keep walking this wellness journey together. Now, let's start with the first surprising snack on the list. One that might look wholesome, but hides a salty, sugary twist. On the surface, they seem like the perfect bedtime snack. A little bit of nuts for healthy fats, some dried fruit for natural sweetness, maybe a sprinkle of seeds. But here's the catch. Most store-bought trail mixes are far from the clean, wholesome blend we imagine. Many brands roast the nuts in heavily salted oils, and that salt isn't just a light sprinkle. A single serving, which is often much smaller than what people actually eat, can contain 200 to 300 milligrams of sodium, and sometimes more. If you pour a bowl instead of measuring, you could easily triple that without realizing it. Then there's the dried fruit. Instead of just removing the water, manufacturers often coat it in added sugar, or even dip it in corn syrup to make it chewier and shinier. That means your natural snack is suddenly loaded with refined sugar on top of all that salt. Why does this matter before bed? Because sodium raises your blood pressure, forcing your heart to pump harder at a time when your body should be slowing down. Too much sugar, meanwhile, spikes your blood glucose, which thickens the blood and can increase the risk of clot formation. A 2020 study from the American Heart Association found that people with high evening sodium intake had significantly higher nighttime blood pressure, and that sustained elevation is linked to a greater chance of stroke during sleep. I remember chatting with a gentleman from Florida, 68 years old, who proudly told me he had swapped his nightly potato chips for trail mix, thinking it was a heart-healthy choice. Within a month, he noticed his ankles swelling by bedtime, a sign of fluid retention caused by too much sodium. He was shocked to learn his healthy snack had more salt than the chips he'd given up. If you love trail mix, here's what you can do. Make your own at home. Use unsalted nuts, skip the added sugar, and toss in a few unsweetened dried cranberries or cherries. This way, you still get the crunch and chew, but without pushing your blood vessels into overdrive while you sleep. Speaking of crunch, let's move on to a snack that often pops up in healthy lists, but carries a hidden danger in every fluffy bite. Popcorn, the kind you see proudly labeled as light, air-popped, or made with heart-healthy oils. Sounds harmless, right? After all, popcorn is just corn, a whole grain, and if you skip the heavy butter, how bad could it be? Well, here's where things get tricky. Many so-called healthy popcorns still pack a hidden punch of sodium and, in some cases, unhealthy fats. The savory versions, even those claiming to be lightly salted, can contain 150 to 200 milligrams of sodium per cup. That's enough salt to keep your blood pressure humming along at high speed well into the night. But salt isn't the only issue. A lot of packaged, butter-flavored popcorns use partially hydrogenated oils or other processed fats to achieve that melt-in-your-mouth texture. According to research from Harvard's School of Public Health, even low levels of trans fat consumption are linked to higher risks of cardiovascular disease. Eating them before bed means your body is digesting and circulating these harmful fats overnight, a time when blood flow naturally slows, increasing the chance for fatty deposits to build up. I remember a woman from Ohio telling me she switched from chips to microwave popcorn as her guilt-free bedtime snack. She was shocked when her doctor pointed out that her blood pressure had actually crept up over a few months, despite no other changes in her diet. The culprit? Her nightly bowl of healthy popcorn, loaded with salt she didn't even taste anymore. If you really enjoy popcorn at night, the best choice is to air pop it at home and season it yourself. Try a light sprinkle of herbs like rosemary or a dash of smoked paprika instead of salt. You'll still get that satisfying crunch without sending your blood vessels into a late-night workout. And speaking of crunchy, salty snacks, the next one might surprise you. It starts with something truly wholesome, but gets a high-sodium twist that turns it into a midnight blood pressure trap. Whole wheat crackers with cheese. Now that sounds like a snack your doctor might actually approve of. Whole grains are good for the heart. Cheese has protein and calcium. So what's the problem? Whole wheat crackers on their own can be fairly healthy, but many store-bought versions already carry 100 to 150 milligrams of sodium per serving. That might seem small, but remember, serving sizes are tiny, often just 3 or 4 crackers. Most people grab a generous handful, which can easily triple the sodium intake before you've even added the cheese. Now, cheese is delicious. No argument there. But it's also one of the highest sodium foods in the American diet. A single slice of cheddar can have 175 milligrams of sodium, and some processed cheeses go even higher. Paired with salty crackers, it can top half your daily limit, pulling water into blood and raising pressure when your heart should rest. A 2019 study published in Hypertension found that high sodium intake in the evening was linked to reduced nocturnal dipping, the natural drop in blood pressure during sleep. Without this dip, the heart and blood vessels don't get their nightly rest, which can lead to long-term damage and increase the risk of stroke. I spoke to a retired teacher from Arizona who loved winding down with crackers and cheese before bed. She thought it was a step up from cookies or chips, but after her doctor advised her to check labels, she realized her light snack contained over 700 milligrams of sodium. She switched to unsalted whole grain crackers and paired them with fresh tomato slices instead of cheese, and within weeks, her evening blood pressure readings improved. If you want to keep this snack in your routine, you can. Just choose truly low-sodium crackers, skip processed cheeses, and try pairing them with avocado or cucumber for that creamy texture without the salt overload. And while we're on the topic of healthy swaps that turn into sneaky troublemakers, the next one comes in a bottle and feels refreshing, but it might have your heart racing when you should be dreaming. Kombucha and so-called natural energy drinks have exploded in popularity over the past few years, especially among people trying to avoid soda. Kombucha, with its trendy probiotic reputation, and natural energy drinks, with promises of plant-based boosts, seem harmless enough. But here's where things get risky. Both often contain caffeine and sugar, a combination that can quietly disrupt your heart and blood vessels at night. Caffeine is a stimulant, and even if you don't feel wired after drinking it, it can raise your heart rate and blood pressure for hours. Studies from the Mayo Clinic show that caffeine's half-life is around 5 to 6 hours, meaning if you drink it in the evening, a significant amount is still in your system by bedtime. For someone over 60, caffeine sensitivity tends to increase, so its effects can be stronger and last longer. Then there's the sugar. While some kombuchas and natural energy drinks advertise lower sugar, many contain 8 to 12 grams per serving, and bottles often have 2 servings. Sugar causes a quick spike in blood glucose, which can thicken the blood and make circulation less smooth. Combined with caffeine, this can lead to irregular heart rhythms and higher nighttime blood pressure, both of which increase stroke risk. I remember chatting with a gentleman in California who loved drinking kombucha while watching his evening TV shows. He thought it was good for digestion, but he also noticed it made him feel slightly restless at night. When he started checking his smartwatch, he saw his resting heart rate was 10 to 15 beats higher on nights he drank kombucha compared to water or herbal tea. If you enjoy kombucha, try having it earlier in the day, say with lunch, so the caffeine and sugar have time to clear from your system before bedtime. As for natural energy drinks, they're best avoided in the evening altogether. If you want a bedtime beverage, stick to caffeine-free herbal teas like chamomile or rooibos, which can help your body wind down instead of gearing up. And from here, we move to another snack that starts out with a genuinely healthy base, creamy nut butters, but gets a sugar-laden twist that makes it far less friendly to your nighttime heart health. Nut butters like almond butter or peanut butter have a well-earned reputation for being nutrient-dense. They're packed with healthy fats, protein, and even a bit of fiber, all things that can help keep you feeling satisfied. But the trouble starts when they get paired with sweet add-ons like honey or fruit preserves, especially before bedtime. Even a tablespoon of honey contains around 17 grams of sugar, and many jams or preserves pack 10 to 12 grams per tablespoon. When you spread a thick layer of nut butter on toast and then drizzle honey or smear on jam, you've turned your healthy fat and protein snack into a high-sugar, high-calorie dessert. The nut butter slows digestion slightly, but the sugar still causes a sharp spike in blood glucose. That spike, in turn, makes your body release a surge of insulin, which can cause your blood sugar to drop again a few hours later, sometimes while you're asleep. This roller coaster effect can trigger stress hormones like adrenaline and cortisol, which raise blood pressure and heart rate, disrupting your deep sleep cycles. A 2018 study in Circulation found that high evening sugar intake was associated with increased nighttime blood pressure and reduced heart rate variability, both markers of higher cardiovascular stress. For older adults, these changes can increase the likelihood of a clot forming in the brain's small vessels during the night. I spoke with a retired nurse from Michigan who loved a slice of whole grain bread with peanut butter and honey before bed. She thought it was better than cookies or cake, but after she began checking her blood sugar with a home monitor, she noticed it spiked 40 points higher on nights she had that snack. Switching to nut butter with fresh sliced berries gave her the sweetness she craved without the rapid sugar surge, and she reported sleeping more soundly. If you adore nut butter at night, keep it simple. Choose unsweetened versions, watch your portion size, and pair it with naturally low-sugar toppings like apple slices or cucumber rounds. And speaking of snacks disguised as health boosters, the next one comes in a tidy little bar, but hides more sugar than you might guess. Granola bars and protein bars are everywhere, in lunchboxes, gym bags, and desk drawers, and they wear all the right labels. Energy, natural, made with whole grains, packed with protein. They feel like a smart choice, especially when compared to a candy bar. But here's the truth. Many of them are candy bars, just dressed up with oats and protein powder. A single bar can have 10 to 20 grams of sugar, often from syrups like brown rice syrup or high fructose corn syrup, which hit your bloodstream as fast as white sugar. That sugar rush doesn't just give you quick energy. It thickens your blood and raises your heart rate, forcing your heart to pump harder. Then comes the crash. When your blood sugar drops, your body releases stress hormones like cortisol and adrenaline to bring it back up. Those hormones can keep your heart rate elevated and your blood pressure unstable through the night, making restful sleep harder to achieve. And sugar isn't the only problem. Many bars are held together with palm oil, soybean oil, or even partially hydrogenated oils to keep them soft and shelf-stable. These fats can increase inflammation in your blood vessels and reduce their flexibility. When this happens at night, when blood flow is naturally slower, the risk of plaque or clot formation goes up. A 2021 study in the Journal of the American College of Cardiology found that eating high-sugar, high-fat snacks late in the day was linked to higher rates of nocturnal hypertension, a hidden risk factor for stroke. I remember a man from Texas who thought swapping his nightly cookies for a high-protein bar was a healthy upgrade. But after a few months, his blood pressure readings crept upward, and his heart rate variability at night dropped. When he switched to plain Greek yogurt with a few fresh blueberries, his numbers improved, and he felt less sluggish in the mornings. If you enjoy these bars, check the label carefully. Aim for less than 5 grams of sugar and avoid any with hydrogenated oils. Better yet, keep them as a daytime snack when your body is moving, not right before bed when your circulation slows. And that brings us to the final healthy snack, a small dark treat with a surprisingly powerful kick. Dark chocolate has long been praised for its antioxidants, flavonoids, and potential heart health benefits. A square or two a day can be good for you, in moderation and earlier in the day. But as a nighttime snack, especially for those over 60, it can quietly cause problems. One of the biggest culprits is caffeine. While dark chocolate has less than coffee, a single ounce still packs around 20-30 milligrams, and the darker it is, the more caffeine it contains. Add in theobromine, another cocoa stimulant, and you've got a combination that can keep your heart rate elevated and make it harder to fully relax. This can prevent your blood pressure from naturally dipping at night, a process that protects your cardiovascular system during sleep. Sugar is another concern. Many dark chocolates under 80% cacao still have 8 to 12 grams of sugar per serving. That sugar can trigger the same spike and crash effect as other sweets, putting extra stress on blood vessels. A 2019 nutrient study found that higher evening sugar intake was linked to poorer sleep quality and increased nighttime blood pressure in older adults. I once spoke with a woman in Oregon who enjoyed 2 squares of 70% dark chocolate every night with her herbal tea. She thought it was harmless, but noticed she was waking up more often. After tracking her sleep with a fitness watch, she saw her heart rate stayed higher on nights she ate chocolate. When she moved her treat to the afternoon, her sleep improved, and her morning blood pressure was lower. If you love dark chocolate, you don't have to give it up. Just enjoy it earlier, ideally before mid-afternoon, and choose varieties with at least 85% cacao to minimize sugar. That way, you can keep the benefits without sending your heart and blood pressure into overdrive while you sleep. Now that we've unwrapped all 7 of these healthy snacks with a hidden nighttime risk, it's time to pull everything together with a warm, encouraging message you can take to heart. So, there you have it. 7 snacks that might look perfectly healthy on the outside, but can quietly strain your heart, thicken your blood, and stress your blood vessels at the very time your body should be resting and repairing. These innocent evening treats can raise blood pressure, disrupt circulation, and even interfere with your deep sleep, setting the stage for long-term damage without you realizing it. The good news? You don't have to give up snacking altogether. With a few smart swaps, like fresh berries instead of dried fruit, lightly salted nuts instead of heavily processed trail mix, or herbal tea instead of sugary drinks, plus better timing, you can still enjoy flavor and comfort without putting your health at risk. Think of every healthy choice as a small gift to your future self. One more step toward protecting your brain, your heart, and your independence for years to come. If this video gave you a fresh perspective on your evening routine, share it with a friend. Drop a 1 in the comments and subscribe to Health 365. Your best nights and healthiest mornings are still ahead of you. A cozy evening, you're enjoying a warm plate of mac and cheese with garlic bread, or maybe a cheesy slice of pizza washed down with an ice-cold soda. Sounds familiar, right? But what if I told you that these familiar food pairings could be silently setting the stage for a stroke? Every year in the U.S., nearly 800,000 people suffer a stroke. And for adults over 60, the risk only climbs higher. It's not just genetics or high blood pressure. We're now learning that the foods we put on our plates, especially how we pair them, might be a hidden culprit. Today, I want to gently walk you through something that could quite literally change your next meal, and potentially your health path. We're diving into 6 innocent-looking food combinations that could quietly increase your risk of stroke. I'm not here to scare you. I'm here to look out for you, like a friend who cares about what's on your plate and what's ahead on your journey. So, before you plan your next meal, stick with me. Some of the combos you'll hear today are ones we grew up loving. That's what makes this so surprising. But don't worry, we'll talk about better choices too. Simple shifts, not drastic diets. If you're curious, and maybe a little concerned, drop a 1 in the comments. If you're feeling skeptical or unsure, that's okay too. Drop a 0. And don't forget to subscribe to Health 365, where we talk heart-to-heart about the things that matter most to your well-being. Now, let's start with the first food duo that might be putting your health at risk without you even knowing it. Macaroni and cheese with a side of garlic bread. It's the kind of meal that feels like a warm blanket. A classic comfort food many of us grew up on and still enjoy on quiet evenings. It's creamy, savory, easy to make, and deeply satisfying. But behind that cozy flavor is a not-so-cozy truth. This combo might be quietly increasing your stroke risk, especially when eaten regularly. Let's take a closer look. Traditional mac and cheese is made from refined white pasta, loaded with full-fat cheese and butter. That means a high dose of saturated fat, sodium, and simple carbs. Then comes the garlic bread, usually white bread spread with butter or margarine and topped with salt or garlic salt. The result? A meal that's high in salt, sugar, from refined carbs, and unhealthy fats. All key players in raising blood pressure, thickening the blood, and stiffening your arteries over time. A 2019 study in the journal Nutrients found that diets high in saturated fat and refined carbohydrates can impair endothelial function, the ability of blood vessels to relax and maintain healthy circulation. That's important because poor endothelial function is a major early warning sign of stroke. It's like having weak spots in your garden hose. The pressure keeps building, and one day it bursts. Now imagine it's dinner time. You're tired. You want something comforting. A big helping of mac and cheese, maybe 2 slices of garlic bread. It's tasty, filling, and feels harmless. But what you don't feel is your blood pressure rising, your insulin levels spiking, or your arteries narrowing bit by bit with every repeat meal. It's slow, silent, and easy to miss until something goes wrong. The good news? You don't have to give up the comfort. Just reimagine it. Start with whole grain pasta, which provides fiber to stabilize blood sugar. Use a blend of low-fat cheese and unsweetened almond milk for a lighter, heart-friendly creaminess. Add steamed spinach, broccoli, or peas for nutrients your brain loves. As for garlic bread, try sourdough or whole grain slices brushed with olive oil and fresh garlic. Still flavorful, still satisfying, just better for your heart. Comfort food should comfort you, not hurt you later. With small changes, you can enjoy your favorites while protecting your brain and your future. Now let's head to a cozy lunchtime combo that may be saltier than you ever imagined. You reach into the pantry, grab a can of soup, and toss a few slices of white bread into the toaster. It feels like the perfect quick lunch. Warm, filling, and easy. But what if I told you that this innocent combo of canned soup and white bread could quietly push your blood pressure through the roof and increase your risk of stroke without you even realizing it? Canned soups are notorious for being loaded with sodium. One single serving can pack as much as 800 to 1,000 milligrams of sodium. And let's be honest, who stops at one serving? Now add in 2 slices of white bread, which may not taste salty, but can still contribute around 250 milligrams more. Suddenly, you're approaching or even surpassing the daily recommended limit in just one meal. According to the Centers for Disease Control and Prevention, excess sodium is a leading contributor to high blood pressure, one of the most powerful stroke risk factors, especially in older adults. Now, here's the science behind it. High sodium intake leads to water retention. That means your blood becomes more fluid-heavy, increasing the volume your heart has to pump. This raises blood pressure and, over time, damages the delicate lining of your blood vessels. For seniors, especially those already on medication or managing hypertension, this kind of dietary stress can be dangerous. It can thicken the blood and narrow the arteries, both of which set the stage for a stroke. Think of your blood vessels like a garden hose. If you turn the water pressure up too high, too often, eventually the hose will start to wear down, crack, or even burst. That's exactly what can happen inside your brain when sodium is constantly putting pressure on your circulatory system. But don't worry, we're not here to cancel soup. There are ways to enjoy this comforting meal safely. Look for low sodium or no salt added canned soups. Or better yet, try making your own at home. You can control the ingredients, reduce sodium, and even add heart-friendly veggies and herbs. And instead of white bread, try whole grain or sprouted bread. They contain more fiber and fewer simple carbs, which helps stabilize blood sugar and support vascular health. And now, let's turn to a combo that's often a go-to for movie nights or quick dinners. Something cheesy, bubbly, and just a little too sweet. You've had a long day, it's late, and nothing sounds better than a slice of hot, cheesy pizza and a cold soda. It's a comfort meal that hits all the right spots: salty, sweet, warm, and fizzy. But when you put these two together, you're not just feeding your cravings. You might also be setting your cardiovascular system up for a rough night. Cheese pizza on its own is already a heavy hitter. It's high in saturated fat from the cheese, loaded with sodium from the sauce and processed meats, and packed with refined carbs from the crust. Now pair that with a sugary soda. One can easily has 39 grams of sugar, and suddenly you've got a combo that spikes both your blood sugar and your blood pressure in one sitting. According to a 2020 study in the British Medical Journal, meals high in refined carbs and sugars are linked with a significant increase in cardiovascular events, particularly among older adults with pre-existing risk factors. But here's what's really tricky. When you eat this combo late in the evening, the effects are even more pronounced. That's because your body is winding down, and digestion slows at night. So the sugar spike from the soda hits harder, lasts longer, and causes a stronger insulin response. Meanwhile, the salt and fat from the pizza make your blood thicker, slow circulation, and increase the workload on your heart just as it's preparing to rest. The result? A night of silent strain on your cardiovascular system and a higher risk of stroke, especially for those with narrowed arteries or high blood pressure. Imagine it like this. You're trying to park a car at night. Everything should be calm and slow, but instead, you slam on the gas and crank the wheel. That's what a late-night pizza and soda combo does to your body. It jolts your system when it should be settling down. So what can you do differently? If pizza's your go-to, try making it at home with whole wheat crust, low-fat cheese, and fresh veggies. Skip the pepperoni and sausage. Those processed meats add even more sodium and harmful preservatives. As for the drink, switch the soda out for sparkling water with a splash of lemon or a bit of fruit juice. You'll still get that fizzy feel without the sugar overload. And most importantly, try to enjoy heavier meals earlier in the day when your body's more equipped to handle them. Giving your heart and brain a break at night can go a long way in reducing your stroke risk. Next, let's head over to another crowd-pleasing combo. Something you'll find in almost every diner and drive-thru across America. You're driving home. It's been a long afternoon, and the smell from the drive-thru is just too tempting. A juicy burger and a side of crispy French fries. It's practically an American tradition. But when it comes to stroke risk, this classic combo might be one of the most dangerous meals you can grab on the go. Let's break it down. Burgers, especially fast food ones, are often made with processed meats that are high in saturated fat and sodium. Now add a large portion of fries, which are typically fried in oils that contain trans fats. Yes, even today, many restaurants still use oils that create trace amounts of these harmful fats. The result? A double dose of artery-damaging compounds that don't just raise your cholesterol, they ignite inflammation in the lining of your blood vessels. Why does this matter? According to the American Journal of Clinical Nutrition, trans fats and high levels of dietary sodium are both linked to endothelial dysfunction. That's a fancy way of saying the inner walls of your blood vessels become irritated, inflamed, and less able to regulate blood flow. When this becomes a chronic condition, it can lead to narrowing of the arteries, blood clots, and yes, stroke. Here's the real kicker. These foods also make your blood stickier. That means your risk of forming clots goes up, especially if you're dehydrated, sitting for long periods, or already dealing with blood pressure issues. So while that burger and fries may feel like a quick energy boost, they're actually creating the perfect storm for a vascular event, especially in older adults with pre-existing risk factors. But here's the good news. You can enjoy the flavors you love without putting your health at risk. Try making your own burger at home using lean ground turkey or a plant-based patty. Grill it instead of frying and load it up with lettuce, tomato, and avocado instead of processed cheese and bacon. For fries, bake them at home with a little olive oil and your favorite herbs. You'll get the crunch without the toxic fats. Every meal is a chance to choose better for your heart, your brain, and your future. Now, let's move from the drive-thru to something a little more refined. Something that shows up on party platters, holiday tables, and even casual wine nights. You're at a small gathering, maybe a family holiday, or just catching up with friends. There's a lovely platter on the table. Thin slices of cold cuts, some fancy cheeses, maybe a few crackers on the side. It feels classy, comforting, and easy to snack on. But behind that elegance, this duo of cold cuts and cheese might be hardening your arteries faster than you think. Let's start with the cold cuts. These processed meats, think ham, salami, are typically packed with sodium and preservatives like sodium nitrite. These chemicals help preserve color and flavor, but they've also been linked to vascular problems. A large cohort study published in Circulation found that regular consumption of processed meats significantly increased the risk of cardiovascular disease and stroke. Add cheese to the mix, especially the creamy, full-fat types, and you're adding even more saturated fat and sodium to the plate. Now, here's where it gets dangerous. When nitrates from the processed meat meet the saturated fat in cheese, they can contribute to a condition called arterial stiffness. This makes your blood vessels less flexible, reducing healthy blood flow to the brain and increasing the chance of clots. Over time, this combination can impair circulation and make the brain more vulnerable to ischemic strokes, those caused by blocked blood vessels. Think of your arteries like garden hoses. When they're young and healthy, they're flexible. But as they stiffen, they crack under pressure. That's exactly what this combo can do, especially when eaten regularly and without balance. And it's not just about long-term effects. This kind of snack can also cause short-term blood pressure spikes due to the high sodium content. For seniors already managing hypertension, even one indulgent platter could tip the balance on a vulnerable day. So what can you do at your next gathering? Instead of skipping the whole plate, make a few smart swaps. Choose nitrate-free cold cuts, now widely available in most grocery stores. Go for part skim cheese or smaller portions of sharp cheese. You get more flavor in less quantity. And add fresh veggies or fruit like grapes, cherry tomatoes, or cucumbers to the mix. They help balance the salt and fat while offering hydration and antioxidants. Simple changes, mindful choices. You don't have to skip the celebration. You just have to protect your brain while you enjoy it. Now let's move to something even more familiar. A sweet, crunchy breakfast so many of us grew up with. There's something nostalgic about a bowl of sweet cereal swimming in whole milk. Maybe it reminds you of childhood, or it's just your go-to quick breakfast when the mornings feel rushed. But this simple, sugary duo, while comforting, might be quietly sabotaging your blood sugar and increasing your stroke risk in ways most people never consider. Let's start with the cereal. Most sugary cereals are made with refined grains and packed with added sugars, some with as much as 12 grams of sugar per serving. Add in whole milk, which contains saturated fat and natural sugars like lactose, and you've created a fast track for a blood sugar spike followed by a crash. This rapid rise and fall doesn't just leave you feeling sluggish, it places repeated stress on your insulin system and blood vessels. A study in the journal Stroke found that individuals with consistently high insulin levels and poor lipid profiles had a significantly greater chance of developing clots and experiencing transient ischemic attacks, TIAs, often referred to as mini-strokes. Over time, this roller coaster of sugar and fat can lead to insulin resistance, abnormal cholesterol levels, and an inflammatory state that primes the body for stroke. Imagine this. You pour yourself a big bowl, sit down at the table, take that first sweet spoonful. It's tasty, it's fast, and it feels harmless. But inside your bloodstream, sugar floods your system, insulin surges to manage it, and fats from the milk thicken the mix. Your blood becomes less efficient at flowing through your arteries, and if those vessels are already stiff or narrow, the risk of a blockage or clot goes up, especially in older adults whose metabolism has naturally slowed. So, how do you enjoy breakfast without the hidden dangers? Try swapping sugary cereal for high-fiber, low-sugar options like steel-cut oats or unsweetened bran flakes. Use low-fat or plant-based milk alternatives like almond or oat milk to reduce saturated fat intake. And consider adding a handful of berries or a sprinkle of cinnamon for natural sweetness without the crash. It's not about cutting everything out. It's about making better choices, ones that protect your brain and your energy for the day ahead. Now that we've walked through these 6 surprising food combos, let's bring it all together and talk about how to turn awareness into lasting, life-saving habits. It's easy to overlook the impact of our daily meals, especially the ones we've been enjoying for decades. But today, you've taken a powerful step by learning how some familiar food pairings could be quietly increasing your stroke risk. And the good news? Change doesn't have to be drastic. By swapping ingredients, rethinking how you combine foods, and making small, mindful choices, you can protect your brain and your heart. Starting today. You've got more control over your health than you think, and every little choice adds up. If this video helped you see your meals in a new light, share it with someone you care about. Comment below with a 1 if you're ready to make a change, or a 0 if you're still thinking it over. And don't forget to subscribe to Health 365 for more tips that can truly change lives. You're never too old to take charge of your health, and we're honored to be here walking